Hello, my name is Leanne Hadley. I'm a PhD student at the University of South Wales. The project focuses on funding for dementia care. This project is funded by the CES2 via the European Social Fund and Cardiff and Vale University Health Board. The project also has support from the Vale of Glamorgan Council. The research falls under a wider project known as Madeline's Project, which was launched in 2018 in Cowbridge. Madeline is a lady diagnosed with dementia who lives in the Vale of Glamorgan. She leads the project in collaboration with various organisations. After Madeline was diagnosed, she realised there wasn't much information, guidance and support for people with dementia. Through collaboration with various organisations, Madeline aims to achieve her top 10 priorities to improve dementia services in the Vale of Glamorgan. This research is aimed at Madeline's second highest priority, which is clear guidance about financial support for care. In Wales, the local authority, NHS, or the individual pays for social care, depending on assessment outcomes. So why should research explore funding for dementia care? One concern is that the current funding system to access social care is considered too complex. Another main concern is that the current social care funding system is not sustainable to meet increased care needs. This is due to an increase in an ageing population and prevalence of dementia. And also, current funds available are deemed insufficient to meet future care needs. There is a need to reform the social care funding system. In Wales, the Holtham report has proposed a Wales Social Care Insurance Fund. This has resulted in an interministerial group to consider future models of funding social care. The aim of the research is to understand the process of paying for social care from the service user's perspective to promote well-being for people with dementia and their families when planning and accessing care. The research questions are: to what extent does the social care funding system work? For whom does paying for social care work or conversely does not work for, following a diagnosis of dementia in later life? And how can a new proposed business case for funding social care overcome these challenges and promote person-centred care? The research project consists of a realist review and realist evaluation with mixed method design. Realist review and realist evaluation are theory-driven approaches to synthesis and evaluation, which addresses the question of what works, for whom, under which circumstances, how it works, and to what extent when evaluating complex social programs. The realist logic of analysis involves identifying context, causal mechanism, and outcomes to construct context, mechanism, outcome configurations. Context refers to social rules, cultural norms and values, geographical and institutional factors, and recipients of the program. Mechanisms can be defined as underlying entities, processes, or social structures which operate in particular contexts to generate outcomes of interest. Wong et al. 2013. Outcome patterns may be unintended or intended patterns of results from the social program. The realist review consists of analysing secondary data, whilst the realist evaluation consists of analysing primary data. During the realist review and realist evaluation process, it is the theories known as program theories which are tested rather than the program. The research involves 3 cycles to develop, test and refine program theories on how paying for social care works or does not work and why, and to produce evidence-informed recommendations for future funding reform, and to produce a product to be used by people with dementia and their carers. This presentation will focus on results from Cycle 1. Cycle 1, development of initial program theories, will involve a realist review, realist interviews with people with dementia and their carers, and documentary analysis. Data extraction for the realist review is currently ongoing. The themes identified so far are presented on the screen. For example, impact on carers, including emotional, physical, psychological and financial impact. Data collection for the interviews with people with dementia and their carers has commenced. However, due to COVID-19, there has been some difficulty recruiting participants. The themes identified from one interview with a carer and a person with dementia included choice and control, unawareness of the social care system, unfairness of the system, inaccessibility of information, and funding reform and expectations. On this slide, an example of a context, mechanism, and outcome for the theme unfairness of the system is presented. The audio clips I'm about to play are not from the original audio file. The quotes are the same and have been re-recorded. So I'll play the first quote.
At the moment, we receive attendance allowance. We get that of the matter of right, no matter what our income is, what our background is.
This quote will be considered a context, and the label given is access to resources based on eligibility criteria. And then the second quote.
We receive attendance allowance. We get the higher of the two amounts there, and we get that of the matter of right, no matter what our income is, what our background is, and to have that as a matter of right simply because we are citizens seem right to me. And I have a feeling that the same ought to apply in terms of dementia care and other long-term care. They ought to be available as a matter of right. I know all of those things, but I think it's just this business of something that is said about a basic right.
This quote will be considered a mechanism. The person believes that receiving funded social care, regardless of financial background, is a basic human right. And then finally, the last quote.
I have a feeling that the same ought to apply in terms of dementia care.
This quote would support the outcome, perceived unfairness of the system. This slide will show how context, mechanism, and outcomes are configured to form context, mechanism, outcome configurations. For example, context 2, access to resources based on eligibility criteria, and mechanism 2, the belief that receiving funded social care, regardless of financial background, is a basic human right, may produce the outcome 2, perceived unfairness of the system. Outcome 2, perceived unfairness of the system, may also be produced when context 3, people with other conditions who have diminishing needs, and mechanism 3, perceived difference in treatment care options despite similar needs, and reduced care choices, lack of consideration for the individual's wishes and preferences are presented. Context 3 and mechanism 3 may also produce outcome 3, which is perception that people are less likely to receive preferred care option due to financial constraints. Alternatively, perceived fairness of the system may be produced when people who are financially comfortable and that person holds the understanding they are limited resources and believe that they should pay towards some of their social care is presented. The next slide will display context, mechanism, and outcomes identified from the review, and how the components are configured for the theme unfairness of the system. When the following contexts 1 to 5 are presented, and mechanism 1, eligibility criteria to qualify for social care is too strict, high, and difficulty accessing the services, this may produce outcome 3, which is the view that it's unfair to charge for social care services. These components may also produce outcome 1 and outcome 2. When contexts 2, 3, 4, and 5 and mechanism 2, the system does not spread financial costs to provide universally funded care, which may cause financial burden. The system has been judged as unfair, confusing, and unsustainable is presented. This may produce outcome 1 and outcome 2. When contexts 3, 4, and 5 and mechanism 3, threshold is an abrupt cliff edge between eligibility and ineligibility, then this may produce outcome 3 and outcome 1. At this stage, we are unsure which contexts and mechanisms are the most prominent to produce the outcomes. Throughout the review and evaluation process, the context mechanism outcome configurations will be tested and refined. The research is set to produce evidence-informed recommendations of future funding reform, which aligns with Welsh Government's aim to integrate health and social care services to create a seamless whole system. The recommendations will aim to increase coordinated, individualised care, which reflects what matters most to people with dementia. The recommendations may contribute towards Welsh Government's national discussion to explore radical options for funding social care in the future. Current results indicate that people with dementia and their carers are unaware of the care funding pathway. The development of a communication method aims to clearly articulate the paying for care pathway to people with dementia and those involved in their care. The project would align with policy and guidance which emphasise the importance in providing accessible information to assist with informed decision making. Thank you very much for listening. If you would like to know more about the study, please contact me on the following email address: leanne.hadley@southwales.ac.uk.